Hey everyone, my name is Rhett and I'm here with Chase, Blair, Lauren, and Jessica. Today we're going to talk to y'all about some policies that are in the works at the federal and state level. One of the policies we'll be talking about at the state level in South Carolina is related to opioid abuse. Since the opioid epidemic is a big issue affecting our country, states like South Carolina have been trying to crack down on this growing problem. This specific bill targets minors in hopes to reduce this epidemic. If this bill passes, medical providers will be required to assess the patient for signs of both substance abuse and mental health issues if opioids are indicated for treatment. In addition, providers must also discuss the risks that opioids have. This includes the risks of addiction, overdose, dangers when mixing opioids with alcohol, and also discussing any other information about the opioid in question. Written consent must also be obtained from not only the patient, but also their legal guardian. And this is done through the program Start Talking. The bill also indicates that the written consent must be a separate document. This bill also states that obtaining consent and discussing the associated risks are not indicated for emergency situations.
The Telemedicine Act is part of recent legislation in South Carolina. This is a bill that the South Carolina Academy of Physician Assistants is monitoring with the goal of improving PA practice by ensuring inclusion. According to the Act, telemedicine is defined as the practice of medicine using electronic communications, information technology, or other means between a licensee in one location and a patient in another location with or without an intervening practitioner. The Act mandates that the practitioner be upheld to the same standard of care of that specialty as an in-person evaluation. One potential problem with telemedicine is the physical examination. This is addressed in the Act because you cannot establish a telemedicine relationship if a physical examination is necessary for the diagnosis. Some further stipulations include the requirement of a medical record, diagnosis, and follow-up care. The Act also allows for the practitioner to have prescriptive authority with compliance within the Act.
So recently, the South Carolina Academy of Physician Assistants reported on new changes affecting Medicare practice across the country. Specifically, 2 new changes to pre-existing Medicare laws now expressly deal with how PAs deal with their Medicare patients. The first change affecting Medicare legislation now allows PAs to manage and provide hospice care to terminally ill Medicare patients. The second change to Medicare amendment will allow PAs to supervise cardiac and pulmonary rehabilitation programs under the Medicare program. So this new legislation is seen as a victory for the PA profession, as it is the first time that legislation affecting Medicare contains language directly affecting physician assistants. Gail Curtis, the president and chair of AAPA's board of directors, had this to say about the new Medicare changes. So literally hundreds of PAs have made the case to members of Congress about the necessity to eliminate the unwarranted restrictions which have prevented PAs from providing hospice care to their Medicare patients. Too many PAs have patients that have been under their care for years who have been forced to choose between continued care or hospice care. This new law will empower PAs to offer continuity of care at a time when the patients and their families are most vulnerable. The changes proposed, found in the Medicare Patient Access to Hospice Act, was designed to benefit rural and medically underserved areas where a PA may very well be the only provider available for hospice patients. The legislation enacted in this act are due to take effect come January 1st of 2019.
In 2014, according to the Substance Abuse and Mental Health Services Administration, almost 50 million individuals had some sort of mental health disorder/issue. A great deal of individuals did not seek help for their mental disorders. This could be directly related to the lack of availability for mental health service providers in rural and underserved communities. Over 90 million people do not have the appropriate access to mental health care. Most of these people come from medically underserved communities. Creating a law that reforms mental health care is crucial for allowing access to health care for those who truly need it. Allowing for the PAs to be an integral part of psychiatry-related mental health services will allow for a solution to the shortage that exists between the number of mental health providers and the individuals in need for this treatment. Within the Mental Health Reform Act, they're hoping to improve overall access to mental health care, allowing PAs to be listed as a specialty provider in psychiatric services, and increasing the availability of mental health care providers overall.
The Bipartisan Budget Act of 2018 was just signed into law on February 9, 2018. Clauses pertaining to the Stark Law were added to this bill in order to help codify guidance that was recently released by the Centers for Medicare and Medicaid concerning their standards for exceptions to the Stark Law. Under this act, 3 major changes to the Stark Law were made. First, the Bipartisan Budget Act creates an indefinite holdover period for certain exceptions to the Stark Law as defined by the Centers for Medicare and Medicaid, whereas previously these holdover periods of exemption from the law were limited to 6 months. Second, the Act stipulates that the in-writing requirement for arrangements that qualify as exemptions to the Stark Law will be satisfied by any means established by the Secretary of the Department of Health and Human Services, including, quote-unquote, contemporaneous documents evidencing the course of conduct between the parties involved. Third, a signature requirement will be satisfied by obtaining the required signatures within 90 consecutive calendar days after the arrangement became non-compliant, as long as other applicable exception criteria are satisfied. Previously, there was no written law to codify this guidance.
That concludes our video. Thanks for watching.